swoop your legs downwards, help lift your shoulder up, use this elbow, dig it into the table, and help me out as much as you can, okay? Alright, ready? Ready? 3, 2, 1, go.
My name is Ross Manigo, and I'm a student PT
That's okay, I got
at
one.
State Hazelton. Is it
So-
okay if I work with you today?
Yes.
Back here.
Nice. Can I get your name and your date of birth?
We're gonna place the sliding board back underneath.
Or
We're gonna do that sliding board transfer
Okay.
back over to
And
our
do you know
wheelchair.
where you are today?
Get you situated, and then we'll have a conversation.
And
Okay.
what
So-
day of the week is it?
Today
4 minutes,
is
you try to lean over a little bit.
Alrighty.
Vehicle.
So I
Perfect.
see on
Fantastic.
your chart that you
Over
recently
here. This elbow on the board for me, please. Same
accident.
thing, scoot yourself over, I'm gonna help you
So,
out, ready?
just to
3, 2, 1,
educate
go.
you, so what's on your chart, it says that
Alright,
you
one more
have
time,
a
let's get you
C6
centered. Ready?
injury,
3, 2, 1,
which
go.
means that anything below the vertebrae C6
Moving
is not
forward.
functioning, which is okay, because today we're gonna be doing different exercises and different, just different treatments
And
that
we're
can
back in.
treat
Okay.
what you have
Alright.
to work with, okay?
That was intense.
But before we get started,
Alright, how are you feeling?
do you have
Good?
any
Not too
pain
tired?
anywhere?
Good.
On
We're
a scale
challenged
from
for
0
exercise, correct?
with no pain to
Okay.
10 being the
So,
most pain you ever felt. What's
for
your
me real
level?
quick, we're just gonna reassess
Yeah, it's
our
like,
skin.
I barely feel
Oh, well,
a little
when you were on the
pain. I
table,
get
I
on
looked
the
at his
scale. I would say
backside,
1 out of
his knees
10.
were good,
1 out
his
of
ankles
10?
were good,
Okay.
toes were
And
good,
what was
the backs of his
your,
hips, his glutes, they were all
like,
okay.
prior
Now we're gonna
level
reassess the
function
skin.
before the accident.
So,
Oh,
skin's all
before I
intact,
had
you're
like
looking
no
good,
issues
no
whatsoever.
bruises,
I
no
can walk
cuts,
around.
no
I'm a
injuries,
severe
feeling all right?
jogger, so
Perfect.
I can used to jog like around my neighborhood sometimes.
Can you show
but
me
now
that
stuck in the
range of
bushes,
motion that we
so
did
that's
earlier? So you're gonna bend over to the side and then come back?
it's what it is for now, and I would like
And then
to
we're gonna
like,
assess
at least
your passive range of motion real quick.
If
So
it's one
I'm just gonna be kind of taking
that's
your
fine.
limbs through a couple
One
different
here,
movements.
so-
Okay.
Flexion.
So yeah,
Good.
we're gonna
Wrist is
strengthen
good.
what you
Fingers
have to
good.
work with.
To the side quick. There we go.
We're gonna strengthen what you have to work with.
Wrist is
But
good.
before,
Fingers good.
so what are your goals?
Looking at our
Goals for
legs,
PT
good.
moving forward?
Good.
Maybe just to help
Knees.
improve moving myself around in the bed.
Okay,
Maybe
ankles,
help just like
and
improve
looking
the
good.
strength in my
Okay, perfect.
upper shoulders.
Alright.
You can do that somehow. I
Okay.
think that'd be
For our
great.
home exercise program.
Okay. Do you
What I
work?
want you to do is read the exact same treatment
Yeah,
that
I
we did
used to work
today.
as a PT.
So when you're in bed,
wow.
I want
yeah,
you to do
in my local
those little
clinic,
walk arounds
I
with
used to, like,
TheraBand because
run
I will be
around,
sending a TheraBand home with you.
doing just a
You're going
bunch
to
of
do
stuff that you can think
3
of.
sets in
but
total. Remember, one side
now
on
I
the
can't
left,
really
one side on the
stand,
right. That
so-
counts as we're gonna place our hand or even both of our arms on your
Alright,
back,
so-
providing that same amount of resistance I gave you today.
That's good.
And
Hopefully,
you
are
can do
you
those little
going
snap
back?
push-ups,
Well,
3
are you
sets.
going back to work?
Okay.
Hopefully,
If you're feeling pain, make sure you stop.
hopefully
Tell
at
me
some
about
point,
it.
if I just like
If
keep
you're
coming
gonna be
back
able-
here,
if
maybe
you're gonna be expected to feel
improve,
sore
like,
in a couple days to come.
from my
That's
upper
completely normal.
lower
Don't worry about it. But if it's an abnormal
legs
level
and stuff like
soreness,
that.
then tell me about
Yeah,
it.
that's my
And then
hope
if
so
you're feeling
far.
anything
Okay,
like,
okay.
pins and needles or
So today,
you're-
what we're
like,
again,
something
we're
fell
going to be
asleep,
doing
like
a lot
that
of
kind of
exercises, high
abnormal
intensity
sensations, tell me
stuff.
about it, and we're
But
going to
so
reassess
you
and
should
review
expect to be challenged.
Okay.
That
And
you
then
might be
last thing I want to talk
frustrated.
about real quick, with the home
you,
exercise program is that
might
the
be
exercises
sore.
that I gave you, you'll be
If you
doing
do feel any
um,
uncomfortable pain, please let me know.
twice a day. I don't want you to do it every other day, just to have some time.
Today, what we're going to be doing is I'm going
When
to
you're
be
in the
teaching you
wheelchair,
how
make
to
sure you can
transfer
kind of move and
using
adjust
the
yourself
sliding
every
board
15 minutes
to get
prevent,
on to the
pressure
table
ulcers.
and back off the
And then
table.
when you're in bed, you want to do that every 2 hours, kind of reposition
We're going
yourself, make sure
to
there's no
be
bed
doing
sores or
exercises
pressure
prone
down
on
pressure
elbows.
up.
And if you don't know what that means,
Okay,
that just means that you're going to
do you
be
have
on
any
your belly, on
questions?
your elbows,
Nice, thanks, let me
and we're
work
going to
it.
be doing different exercises to strengthen what you have today. The benefits of this position, it helps you improve upper trunk and upper extremities. It helps weight bearing through your upper extremities, and it helps increase range of motion for your hip extensors.
Okay.
It also increases your base of support and your center of mass. And it's just good for bed mobility and training because I mean it's a good functional position for you.
I see.
Do you have? I know on your chart it says that you're taking Jardiance. How's that doing for you?
I mean, it's working so far. I haven't felt any side effects or anything like that.
Okay, good, good. All right, so I'm just gonna do just a quick skin assessment of what I can see right now. I'm gonna do another assessment while you're on the table.
Okay.
All right. The front of your shoulders look good. I'm just checking under the skin. I'm gonna look at your elbows. I'm looking at your knees. He's wearing shorts, so I can see his knees. Your feet look pretty good. All right, so before I even get started with that, I'm going to do some measurements of cervical lateral flexion. So that just means like you're bringing your ear to your shoulder.
Okay.
All right. Can you bring this ear to your shoulder here? Any pain with that movement?
Nope.
All right. You can go back. And then I'm lining up the fulcrum with C7. And then I want you to bring your right ear to your right shoulder. All right. You just realign. Realigning. Okay. That's good. You're doing great. You have about 49 degrees of cervical flexion.
Oh, okay.
Or lateral flexion. 45 is normal.
Oh, okay.
So that's good. So what we're gonna do is we are going to start our exercises. I'm gonna transfer you to the belt, to the table, and we'll do our exercises, okay? Cool. Before we go anywhere, I'm going to place this belt on you. This is a gait belt. This is what I hold on to you for like transferring, or if you happen to like lose balance in any way, this is what I grab onto.
Okay.
So it's for both of our safeties. I'm gonna apply it. Is that okay?
That's okay.
Okay. Can you raise your arms for me? Very nice. Okay. Okay. Is that too tight?
Nope.
Okay. So what I'm going to do is I'm going to angle you here. I'm going to take off, just lean towards here. All right. All right. So I'm putting this to the side. We don't do clutter here. Here we go. And we're protected. Let me just put this on the side. Bam. Bam. So what this entails is that I'm going to be holding onto here. I'm going to slide this board onto under your butt.
Okay.
And then it's going to be like a process. So what you're going to do is that after I slide this on, you're going to put your elbow on the board, and we're going to count to 3, and we're probably going to do 3 scoots, and then you're probably going to put your head down here. I want your head on this side.
Sure.
All right. So can you lean over? All right. Are you good?
Yes.
Okay. So then what I want you to do is put your elbow here. All right. And then on the count of 3, we're gonna do our first scoot. Okay, ready? 1, 2, 3, scoot. 1, 2, 3, scoot. One more. 1, 2, 3, scoot. Alrighty. So what we're gonna do is that I want you to put your head down here. Use this to guide yourself down, and I'm gonna swing your legs up, okay?
Okay.
Ready? 1, 2, 3. All right. Scooch towards me. Okay. And then what we're gonna do is that I want you to, we're gonna be on your elbows, so I want you to roll towards me, okay? But what I want you to do is put your elbows together, like bring them up above you, and then bring them together like this. And then I want you to use your momentum to swing yourself towards me, okay? Ready? So swing, keep swinging, and then swing towards me. Okay. All right, readjust yourself. Very nice, and then we'll straighten out your legs for you. Okay. And then I'm just gonna scoot you down, okay?
Okay.
Ready? 1, 2, 3. Okay. And then scoot you towards the middle so you have more room to work with. Very nice. Are you comfortable?
Yes.
All right. And you're safe and you're sound. What we're going to do is our first exercise. Actually, I'm going to check your backside now that I can see.
All right.
I'm checking your calcaneus. I can see that there's no issues. I'm checking the back of your leg. I'm checking your glutes. I see that there's no ulcers there, and I'm checking your scapulas now that I can see them, and I see no issues there. And I can see your elbows from here. that they are also still intact. So now that we did that, what I want you to do is go directly on your elbows, push up, and then I want you to do like a scapular push-up. I'll put it here with you.
Okay.
What you're gonna be like, and then just go down, and then up 10 times.
Okay.
2, 3, 4, 5, 6, 7, 8, 9, 10. All right, you can relax and take a break.
Okay.
Any pain with that?
Nope.
Is this a good intensity for you?
I think so, yes.
Okay. So you did 3 sets of 10, and that was great. But now what we're gonna do is just basically, this is a good exercise, not only for like strengthening like your scapular retraction and like just overall flexion, I guess. But it's good for bed mobility. It's good for bed mobility. So this is a good exercise to take home with you, which you are taking it with you, and I'll explain that later.
Okay.
All right, so first I'm gonna put this TheraBand on your hand, and then spread them apart, and then I want you to do 3 shimmies with 3 laps, which is you going back and forth 3 times.
Oh, okay.
Nice.
Seems pretty good.
All right. And, okay, you're good, you're good.
Okay.
Any pain with that?
No.
All right. Okay, so what we're going to be doing now is I'm going to do just another quick post-skin check.
Go right ahead.
All right, I'm checking your calcaneus, I'm checking the back of your leg, I'm checking your back, I'm checking your scapula, I'm checking your glutes. Everything seems to be intact. Are you feeling any pain?
Nope.
Great. So then what I'm going to do, let me get this here, realigned. Where is my armrest? Commercial break. Okay. I'll put it right here. The wheelchair is locked. And we are ready for a transfer. Okay. So what I want you to do first, actually, yeah. So drop this elbow and then push up on the table so it causes your body to roll towards me.
Like this?
Yep. And then we're gonna do another little, you're gonna stay in this position, but I want you to shimmy like towards me. So like use this elbow to guide yourself closer to the edge of the table. All right, you're good. Okay. So then what I want you to do now is we're gonna swing your legs over the table, okay? Ready? And then you're gonna push up on this side.
Okay.
Okay? And good. Any pain with that?
Nope.
Okay. So I'm gonna bring this closer to you. I'm gonna slide this, so I'm gonna lean you over this side, this side. Lean to this side so I can slide it under. Okay. And then I want you to put your elbow on the board here.
Okay.
Okay. And then we're gonna do our 3 scoots again, okay?
Yep.
Ready? 1, 2, 3. 1, 2, 3. All right. You can lean to this side again. Okay, how do you feel?
Pretty good.
So, what I'm gonna do is that I'm just going to reassess your skin. I'm just gonna check your elbows here. I'm gonna check what I can see. I'm gonna check your knees, and I'm gonna check the front of your foot, and I can see that. Can you do the flexion for me to the right side? Any pain with that?
Nope.
All right. And then you do have elbow flexion, but I'm gonna just do some passive range of movements here. Take your legs. And over to your foot. And then if you had toes, I would do your toes. All right. So now your home exercise program. Your home exercise program is what we did today, the same amount. You're gonna do 3 sets of 10 of your scapular like push-ups.
Okay.
And then you're gonna do 3 laps on your bed safely of you just elbowing side to side. If you have any pain at home, you need to stop and we will reassess, okay? To prevent any ulcers at home, what I want you to do, if you're in your wheelchair, you need to readjust yourself in the wheelchair every 15 minutes. And that should prevent any like pressure ulcers from like the back of your legs or your back or your butt.
Okay.
Because that's where they're very common. Okay. And then if you're in the bed, you have to move every 2 hours. Again, I want you to do like just a little adjustment so you're not putting pressure on the same places.
I see, okay.
Did you have any other questions for me?
Nope.
Okay. Thank you for working with me.
Thank you.
I'm sanitizing my hands. This is Ross, signing out. Oh yeah!